You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with small diameter or mini dental implants. With us, we have an expert on the topic. He says nobody should be wearing a loose fitting denture. With us, we have Dr. Walden. Dr. Walden, welcome to the program.
Thanks for having me, Randy. It's a pleasure to be here.
Now, before we get into today's topic, for people that don't know your practice, I mean, I guess you have one of these concepts where you do everything right there under one roof.
Yes,
so who's the typical patient?
Well, we don't have a typical patient. You know, we see patients from the very young to the very old and all in between. You know, we're general dentists, so we do all types of dentistry. You know, we'll do whiten your teeth, we clean your teeth, we treat gum disease, we do root canals, do fillings, crowns, veneers. You know, we rebuild your smile, we can rebuild your entire mouth, build your bite back, work on your TMJ, and we do implants.
Okay, now you love dental implants. You say it's the newest trend in dentistry.
Implants are, to me, is where dentistry is going, and it's the future. You know, people don't have to go without their teeth. They don't have to have slipping dentures where they have to put that gooey adhesive in there, and you know, they chew like a cow. They have to grind on their teeth, and you know, it makes for bad breath. They're embarrassed, and you don't have to do that now. You know, we can go in and is one appointment, take their denture, put the small diameter implants, and then in an hour they walk out with their teeth in. No adhesive. We had a lady just a couple weeks ago. Now we do sedation in our practice. We're known as a sedation dental practice. We've been doing that since 1997. So we're sedating patients every day. The lady, she was sedated, had her small diameter mini implants replaced in, her denture secure, and as they were taking her out to her car in the wheelchair, we have a refreshment bar in the reception room, and she said, "I want one of those cookies." And she took a cookie and ate it on the way to the car.
So you can eat that soon?
You can eat that soon.
Yeah, but when you say things like you could walk in on the day of the procedure without teeth, you have no teeth that day, and you walk out with a full arch of teeth on the upper and lower that maybe even don't come out, that's possible.
That's possible.
Today.
That is possible. I mean,
is that right?
It's amazing. You know, we can have your dentures made, and we put the implants in, and that's what's so nice about the small diameter implants. You can go in and load them that day, and the patient can be wearing them that night. And we have them come back the next day to check them, but I mean, it happens all the time.
Okay, good. Now you've been in and around dental implants for quite some time.
A long time. I've been working with implantology for over 20 years. We've been placing the small diameter implants for over 10 years.
So these small implants, they're different than the regular implants. Some people might say, I've had dentists on the show, I don't know, Randy, I don't know if they're there yet. I don't know if they work as well as regular implants. And I guess regular implants, as you say, are almost double the cost. So what do you say to that if somebody says they're not?
Well, you know, it's understandable for people to say that. You know, I've got a daughter that graduated from dental school 2 years ago, and she goes, "Dad, those small diameter mini implants, they don't work." I said, "Yes, they do." There was a study by Todd Shackton, who I trained under him. He's one of the pioneers with the mini implants, and a 10-year study where it showed that the success rate of the small diameter implants was 94%. That's right there with the other implants.
So they are less expensive?
Less expensive, and the amazing thing about it, they're less expensive, they are less invasive. You know, you put the implant in and there's no pain, there's no discomfort, and you get to wear your teeth that day.
You say it's like having a third set of teeth.
Yeah,
Elaborate on that.
Yeah, well, you know, we have our baby's teeth, and then we have our permanent teeth. And if you're unfortunate enough to lose those, then this becomes your third set of teeth. You actually have another set of teeth, and we can fix them to the jawbone. You know, what's so terrible about wearing dentures is they're not attached to anything.
Okay.
You know, we're in Kentucky, so we you know, follow the horses a lot, and you know, it'd be like if you put you were going to ride a horse, and you put the saddle on, and you didn't strap the saddle, and then you're going to take off with the horse, and the saddle's going like this. Well, your dentures are doing the same thing, especially the lower denture. You know, we have a tongue that is not attached. You know, the teeth aren't attached. So whenever you speak, eat, chew, that tongue moves, and it's going to make the denture move. So with the mini implants, we can put them in.
Just like lock them in the mouth.
You lock them in the mouth. Now you can chew and eat. You can smile with confidence. You know, I had a couple different patients. One, they sing in the church choir, and they're afraid that they're going to be singing and their dentures are going to fall out.
All right.
And so we put the minis in for him, and you know, it gave him such a confidence now. I mean, he had a great voice, but now he feels like he can smile and he can sing and do the solos, and the teeth aren't going to come out. And you know, that's life-changing for people. It is life-changing.
Now, as far as dentures go, are there a lot of people wearing false teeth in Paducah, like an upper or lower denture or headed to dentures?
Yeah.
How big of a problem is it where you are?
It's a big problem. You know, Kentucky and West Virginia lead the nation in people with dentures. There was a 2004 study telling, and it stated that 1 in 10 people in Kentucky are missing all their teeth. That's 1 in 10. Well, Kentucky has about 4.5 million people, and so you're looking at 450,000 people with all their teeth
Wow.
out. And the University of Kentucky football stadium, you could fill it 10 times with those people, 10 times. And now that's for people missing all their teeth. Well, what about the people who are missing half of them or 6 teeth?
Are they mostly headed to dentures, people that have like 6 or more teeth missing? I mean, they're going to end up with no teeth?
It's a good chance that they're going to end up that way. Now, you know, the good thing about it, we can take a partial denture, which is half a denture or part of it, and I can put mini implants in. I've done this many times, and they can still take that partial, so they still keep what teeth they have. We put the implants in. Now they're partial secured. It keeps the bone from getting worse, and you know, it doesn't go away. And you can take those ugly little clasps that hook around the teeth. You can take those off, and you snap the partial plate into the implants, and it's great. You know, the 3rd set of teeth.
Okay, now if mini implants are so good, right, getting a permanent set of teeth, if it's so good, why, and there's 450,000 plus people with no teeth at all where you are, then why aren't they all doing it? What's your take?
Well, you know, that's a really good question. And when people get their dentures, they usually don't come back to the dentist. You know, they may have a couple adjustments, and then you don't see them. You know, they may come back for a reline, but you don't see them. And they think they're stuck with this horrible denture, you know, and there's nothing they can do about it. So they don't know their options. They're kind of out of the loop.
All right.
You know, another reason is that, you know, typically people who are missing their teeth, you know, it didn't happen all at once. Their teeth have been bad. You know, they've been going to the dentist, you know, they have fillings, had to have root canals, and the root canal fail. The tooth comes out, they got bad breath, they got gum disease, and they've been doing this for maybe 15, 20, 25 years. And these people say, you know, I'm brushing my teeth, I'm doing everything I can, but I'm still losing my teeth. And so finally, when they get that denture, it's almost like a relief. It's like, I'm done going to the dentist. I spent all this money over these years, and now, so you know, so
they tell you this?
Yeah, you know, it's
because it's expensive too.
Yeah, right. But and the thing is, you know, they're not going to say they hate their dentures. They feel like they're stuck with them. You know, this is something they're going to have the rest of their life. So, you know, they're just kind of relief, and they're out of the way.
So they just don't know their options. Is that your take?
They don't know their options. You know, and then people have been going to to get the teeth. They you know, going to the dentist, you know, spend all this money. He said, so I probably can't afford it to have implants. They just think that. You know, they haven't been going, they're out of the loop, and think, well, I can't afford it. They don't realize that it's very affordable. And there's ways that we help people. There's ways that we can, you know, do financing and do this and put it into their budget. And to, you know, and a lot of people, if they don't even know that, they say, yeah, I would get rid of this loose, ill-fitting, ugly denture tomorrow if I could afford it. So they think they can afford it.
How old can you be to do this?
Age is not a factor. You can be in your 90s. You can be age that has nothing to do it. And you know, somebody that's 90 years old, they want to eat and chew just like you do.
Yeah.
I mean, you know, their enjoyment in life is being with what friends and family they may still have left. You know, some of them are in assisted living places. So, you know, when the grandkids come and visit them, and you know, they're gonna bring them some food, some snacks. You know, they want to be able to chew and eat.
Yeah, but what about gum disease, bad gums? Can you still do this, or the gums are too bad, you can't do it?
No, you know, and it's a good question. You think you got the gum disease and you got termites in the floor and you can't do anything. But once you take the teeth out, then the gum disease goes away. Then you have healthy bone. You know, the bone doesn't have any nerve endings in it. The only nerve endings you have are in the gum. So now all the bacteria is gone, and you can put the implants in. That's why there's no pain putting the implants in, because there's no nerve endings in the bone.
So even with people with like bleeding gums, loose teeth, those people can get a full arch of teeth, upper or lower, that are locked in.
Locked in.
Is that right? Okay.
Once you take the bad teeth out, then we can make the gums, they will become healthy. Then you make the dentures, and you put the implants into the now what is healthy gum, and you're good to go. You know, back to your original question, why aren't all these people coming in? Well, you know, they think that they can't afford it, but they don't realize that the small diameter implants are half the cost of the larger implants. They can, you know, they can pay for it and come in. They can get the teeth in a day and start wearing them, and it's affordable, half the cost. So they're seeing, you know, they're thinking that the only people that can have these implants are the movie stars. The people out in Hollywood. You know, no, these are for everybody. It's just like when you had flat screen TVs when they first came out. They were so expensive, and only the rich people could have had them. Now, look, everybody's got flat screen TVs.
That's true.
Now, most anybody can have mini implants.
Insurance doesn't cover the whole thing, even if you have the best insurance, and Medicare, Medicaid doesn't cover this. So what do you do for those people?
You know, we don't want costs to be what keeps somebody from getting their teeth. You know, we have people in my office that they work every day trying to help you with financing, working with your insurance, and trying to get the maximize the dollars they can get for you. So we're there to help you, and we don't want costs to stand in the way of what you really want.
Okay, good. Now, we should mention, I guess the way implants are normally done, there might be 2 or 3 people involved. One person, the surgeon, that puts the implant in. Correct me if I'm wrong here. A second person that puts the teeth on top, and then maybe somewhere else that does the imaging. You do it all right there. Aside from convenience, what's the advantage?
Well,
with doing it that way, the way you're doing it.
You know, for one thing, the patient, they've been coming to our office. They trust you and like you, and they don't want to have to go someplace else. You know, we have our own imaging machine. We can image right there. We can tell if you've got enough bone, and most people do. We can make your denture for you. We can take the teeth out for you. We can put the implants. Now, we have great specialists in Paducah, and we utilize them, but most of the cases we can take care of right in our own office.
Right there. Now, but isn't it true that if you've been wearing a denture for, let's say, 20 years, you just don't have enough bone to do this?
That's not true. That's not true.
Really?
Now, most people, well, you know, there's different sizes of the implants, different lengths, and with the imaging that we do right in our office, we can measure the bone and know how much bone you have. So now,
do you ever have to turn away people and say you don't have enough bone?
Very rarely. Sometimes, now, you can, even if you don't have enough bone, you can do some grafting and you can get some bone, but rarely do we have to turn people away. Just this past week, Randy, we had a lady that came in, and she'd been told by another dentist or 2 that she didn't have enough bone for implants. Well, we did an image, and Dr. Mangino, my partner, we both looked at it. We said, well, we better check this real close here because she's been told by other people that she didn't have enough bone. Well, she had enough bone. And, you know, so there's no reason why.
So what are you doing that's different than these other guys? If you're saying, you know, they have enough bone at your office, they don't have enough bone at the other office?
If they come from another dentist that doesn't do small diameter implants, they only use the big ones, then, you know, there's not enough bone. And these are cases that, you know, years ago you couldn't do. But now with the small diameter, the width is there, you can put it in. You know the length, you know the width, and, you know, it works. We had another patient that comes to mind, and she was in the office. We sedated her, which we sedate, you know, we sedate over probably half of our patients, and they love the sedation. We sedated her, took a tooth out, placed the implant in, did some grafting, and so I called her the next day to see how she's doing, and her actual words is, "I'm amazed I've had no pain, no discomfort." It's truly amazing.
So you called her.
I called her.
Asking about pain.
I called to see how she was doing, and what is truly amazing to me is that most of our patients have very little discomfort, and I think it's, you know, it's 2 or 3 different things. One is the sedation. The sedation, it relaxes you. Our patients, you know, they're high fear, they've had bad experiences, and the sedation makes you comfortable and relaxed, so you're not tensed up. So that's a plus right there. And then the mini implants are just non-invasive. You know, you're not having to lay the gums open. They go right in like a wood screw, and it's non-invasive, very little discomfort, and
so it's minimally invasive, we should say.
Minimally
invasive. You know, after doing this show for now 18 years, we always have to, whenever we talk about pain, we have to say everybody's different, and, you know, have that disclaimer. Right. But you're saying that your patients actually tell you, that it doesn't hurt that much.
That
It's less than what they expected.
Yeah, and of course everybody's different. Every patient's different. And some people, you touch them like this, and oh, it hurts. And some people you can smack them, and it doesn't hurt them. So everybody's pain threshold is different. But the majority of the people have very little discomfort.
How soon could you go back to work? So let's say it's on a Friday or Thursday or Monday. If everything works out, they came in with no teeth. Now they have teeth. How soon could they go back?
They can go back to work. That if we sedate them, of course they can't go to work because they got to wait till the next day. You go back the next day. True story. We have a dental assistant in our office that needed an implant, and so we knew that we had a spot in the schedule. So we were working along. We had an hour, put an implant in her. She went back to work after that. We put it in. She worked the rest of the day. I mean, it's truly amazing.
So now she's a believer.
Oh, absolutely.
Obviously.
Yeah.
Okay. Now you say you're changing people's lives.
Changing lives, and a smile. The window to the world. And when people put up with bad breath, bad teeth, where they're afraid to let people see. I see this every day. People come in, and even when they're talking to the dentist, they're covering their mouth. They don't want you to see what they've got, and then it makes you feel so good when you can go and give them a smile. You can give it a smile with a denture. You can do it with, porcelain veneers. You can do it with fillings, crowns, and caps. But these people who are totally, that their teeth are mangled and twisted and distorted, and they have to have their teeth taken out, and you put the implants in, and you change their life.
So they look real. Like if I saw them, I'd say this is good. You call them what? Cosmetic dentures? What do you call them?
Our dentures look real. We've got trained people that are going to spend the extra time. We don't want it to look like like white chiclets, a white chiclet fence. We want it to look like a real teeth. We customize the dentures to make it look natural, and we can use any color teeth we like, and we don't want it to look fake. But our dentures are beautiful.
Now you told me on the phone that when you show them their teeth, sometimes they're smiling in the mirror for the first time. They get emotional.
They get emotional. I mean, the tears will come down their cheek. I've had you show them the mirror, and they're just amazed. And I've had a lady that comes to mind that she couldn't afford to have dentures, and we were willing to help her, and some family members helped her. And so she had been going without teeth. And this was a lady in her 40s, going around.
No teeth at all?
No teeth at all. And then when we made her teeth, and her husband and daughter came, and they all cried. I mean, this was the first time this lady could smile. And, like it or not, your self-esteem, if you can't smile and converse with people, your self-esteem's not, you give them a smile or teeth.
Well, you're a dentist.
Yeah.
Of course you think the smile's important.
It is, but like I say, it's the window of the world. You walk in a room, you don't know anybody, and you see the lady or the man across the room, and they're smiling and engaging with people, and the smile is,
That's charisma.
It's charisma. People go into a job interview. You're sitting there interviewing people, and the one that comes in is smiling and outgoing. I mean, it catches your attention. And the one that doesn't smile and frown, it's just different. And we'll get this guy, the big burly guy comes in, 6'4", and he just wanted his teeth fixed and in a hurry. I don't care what they look like. Then all of a sudden you get these new crowns and veneers or whatever you have there, and all of a sudden he's got a really nice smile, and people are complimenting, man, what's happened to you? You're looking really good. And then now they're excited, and that's not what they wanted. They just wanted to chew and eat. But now they've got a pretty smile, and people are complimenting them.
Now a big guy like that, you mentioned a 6'4" guy. If you give him a fixed set of teeth, full on the upper and lower, supported by these mini implants, could they eat like bite a carrot with their front teeth?
It's amazing. When they put those implants in, the dentures don't slip now. Now they're anchored. Now you can go in and bite into an apple. I've had a lady say, this is the first time I've been able to eat lettuce, because the dentures would move and they couldn't cut into lettuce. They eat their steaks. Peanuts. They say, oh, I can never eat a peanut. Now I can eat peanuts. I mean,
popcorn. I mean, you can eat whatever you want.
You can eat popcorn, anything you want. So I would just say, Randy, for people out there that have these loose slipping dentures, and they're out there, and some people just aren't complainers. But if you've got the loose slipping denture, there's no reason why you can't go in and have these small diameter implants, have them placed in, then you've got the denture that's locked in. You can eat the foods, you can bite into that apple, you can eat the popcorn.
No more adhesive or a little bit of adhesive?
No more adhesive. No more. I mean, I've had people they've had good fitting dentures, and especially some ladies, they just want that confidence of having the adhesive. But once you put the implants in, no more adhesive. They're not worried that they're going to be out eating with their friends or neighbors and their teeth slip.
Now you say there's so many people where you are wearing dentures.
Lots of people.
And like, what are the younger ages that you see wearing dentures? I mean, 50s? Are they doing it in their
Well, I've got people in their 20s wearing dentures.
Is that right?
People in their 20s wearing dentures. So, I've got people in their 20s to their 90s and wearing dentures. And, a lot of people won't complain about them.
Because I know people, they never complain about their dentures.
Complain. They'll come in and complain to us, I hate, wearing a denture and blah, 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 what can do, because we don't see these people that much because they're out of the loop, like we discussed earlier.
Okay.
They're out of the loop of going to the dentist. They don't know what their options are. And so, they're not complainers, so they're not going to complain about it, but they're slipping, they don't like them.
So if you're dating,
yeah.
I mean, when you were saying that there's 40-year-olds, 50-year-olds, and 30-year-olds in dentures, it's got to be probably embarrassing, maybe.
Where we really see it happen is when there's a life-changing event like a spouse passes away. And then, you got your grievement period, and then when the person decides, hey, I'm going to get back into, maybe I'm going to start dating or something like that, then they get real conscious about those teeth. And they're the people who come in to you say, I don't care what we do. I got to get some teeth fixed. I got to get some implants for dentures. I got to get some caps or veneers. But I met a lady, and I'm going to. And this happens. Or some another event is a divorce. When somebody gets divorced, and they're jilted, and they lose their self-esteem, and then they said, I've got in order to get back into it, nobody's going to want to go around and be with somebody that's got nasty teeth. And they'll get them.
Now, we are short on time, but just as a recap here, 2 options. So for the denture wear, they can get a full arch of teeth that snap in, snap out, or they can get full teeth that don't come in and out. So do you need a mini implant for every tooth?
Well, you don't have to have it for every tooth, but depending on the length and the width and what the bone's like, I mean, you may put 7 or 8 in there or more if you want them locked in, and that's a great choice. I mean that's kind of the ultimate, where if the person has teeth that are locked in, they don't take them out, and they're very secure. The other option is you have fewer implants, and there are snaps in there, and they take the denture in and out.
We haven't talked about the upper denture. Upper denture is fine because of what? The suction?
You have a suction, you have a palate, but so many people want to get rid of the palate. They feel like they can't taste their food, they can't speak as well, and it just covers the whole roof of your mouth. So with the implants, you can have the roof of the mouth taken out, and now you feel like you're tasting your food better. You feel like it's your real teeth. It's not something plastic up in there because you don't have a plastic roof.
Now, you said you've made a lot of dentures.
Yeah, I've been practicing 35 years, Randy.
Like hundreds and hundreds of dentures.
Hundreds of dentures. So, and that's what I want to tell my patients that I made a denture for, years ago.
Because they might see this.
If they're watching, if I made a denture for you years ago, and of course, we don't see you much anymore, or may not see you at all. But now you can come in and have that denture snap, where you can snap it in and locked in with the implants, and there's a lot of people out there like that. So
now the people I'm sure you've dealt with people in your practice that were wearing a denture and then they converted over to getting it snapped on, right? What do they say? Like, do they say I should have done this years ago?
People they will say, and rightfully so. Some of these people, they're busy. They're raising their kids, so the kids come first, and they say, well, I'll take care of myself later. But then it comes time, the kids are raised, and they say, okay, now I'm going to go back in and say, okay, what can we do for this denture? I want the roof out, and we put the implants in, and then and they said, oh man, I wish I had done this years ago. Why did I wait? Why? But sometimes it's realistic. We have different priorities in our life, and maybe at the time they felt like mom's put put themselves last and then the rest of the family first. So, but they all say once they get them in there, they don't want to go back the other way. I mean, once you've got something that snaps in where you can chew, bite that apple, popcorn, they don't slip, take out the adhesive, take the bad breath away. They wish they'd done it sooner. So there's way, and that's what I want people to know, that there's ways for us to help you get there. We'll work with your insurance, we'll work with your financing. If you feel like they're not affordable to you, we'll find a way to help you out.
So when people come to your office, I'm sure they're wearing dentures. They come to you for a reline, right?
Right.
Is that right? To adjust their denture, and it puts you in a position where you feel like you're selling something, telling them maybe they should get implants, but because I'm sure when it's all done, they're going, "Why didn't you talk me into this sooner?" Have you ever heard anything like that?
That's right. Sometimes you people, they've got the dentures. You don't want to be pushy and say, "Why don't you do this?" Or it's kind of like somebody that's got dark teeth, and you think, "Well, if we could whiten them up, it'd look better if you put some veneers." But sometimes, we dentists, we don't want to be pushy.
So it's a touchy subject sometimes, right?
It is. But I think we kind of owe it to ourselves. Well, at least I'll let people know what's available. And sometimes we have to take it this way, Randy. Say, Mrs. Smith, you've been coming in here for years.
Yeah.
And, sometimes we forget to tell you what's some of the latest advances. So we ask you, would you be interested in hearing what's available now that wasn't available 10 years ago? And most times they'll go, "Oh, sure, I'd love to." Then, we can say, well, we can take that denture and snap it in. We can take the yellow teeth and make them white. We can take your crooked teeth and make them straight, where you have that nice, pretty smile. So, as dentists, sometimes we need to step back and say, okay, it's our duty to tell you what's available and what the advances in dentistry are.
So you're going to wipe out dentures? No more traditional dentures in Paducah?
That's right.
So consultations, if they're seeing this, they can go in, they get to see you.
Yep.
And free consultation.
Free consultations. We'll do it. We'll even do a free scan.
Now Medicaid does not cover this.
No,
but
unfortunately, Medicaid, Medicare, doesn't cover dental options like that. They don't do implants, they don't do the dentures and stuff like that. So, we'll be glad to help them. We'll help maximize what we can do for them. And but yeah, free consultation, free scan.
So if everything works out, somebody watching this, and they're wearing an upper and lower denture, and we literally have a minute left. But if everything works out, they go to your office, how soon could they have their teeth, maybe that don't even come in and out?
I mean, they can come in and have the implants placed. Because they'll come in
like a month from now?
Consultation, less than that.
3 weeks, 2 weeks from now?
They can have the consultation. Once we know what the bone looks like and determine where we're going to put the implants, then it's a matter of putting them in and locking the denture.
So like 2 weeks from today, 3 weeks from today, if everything works out.
Yep, absolutely.
They're done.
Yeah, and that's using their existing denture. Now, if we want to make new ones, it takes just a little bit longer because we have to customize a new set for them.
Do you like to do that?
Absolutely.
Give them a cosmetic look?
We want everybody to have the best look.
Okay, good. I want to thank you for coming on the show.
Yeah, thank you.
Great info. If they want to find out more, they go to your website and they get to meet you.
PaducahDental.com.
All right. Thanks so much.
Thank you, Randy.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.